Hello, everyone. Thank you so much for joining me today. I'm very thrilled to have you here, and I'm really excited to dive into how you can improve your understanding and relationship with one of your largest customer bases, which would be nursing homes. I'd first like to congratulate you on your commitment to gaining a deeper understanding of one of your largest customer segments. Your dedication to enhancing your knowledge as a vendor reflects highly your desire to serve your customers more effectively, which really does set you apart in the marketplace. My name is Becky Ziviski. I am a CPA and also a nursing home administrator. I'm the CEO of Profit Without Census. I've been in healthcare for a little over 20 years. I started my career as an auditor and then moved into healthcare, which really is my passion. I've worked in nursing homes in a family-owned facility as well as corporately owned facilities. I've done nursing home consulting. I also wrote a book geared towards nursing home administrators called Profit Without Census, a nursing home administrator's guide to profitability by department. So it basically focuses on how an administrator can really maximize the position of their organization by focusing on each department. That actually would probably be a good resource if you're interested in learning more about all of the individual um, departments within a facility. So I would highly recommend that as a resource. I'll have some information about that on the last slide. Um, but as a former nursing home administrator and CFO, I'm going to go ahead and share some of my behind the scenes knowledge into nursing homes so that you have a better understanding um, of what nursing homes do, who makes decisions, all the good information that will really help you in your relationship with them. We're going to talk about some of their challenges, what a typical organizational chart looks like so that you understand who the decision makers are that you need to be reaching out to, who cares about the budgets, including supply and software costs, which is going to be very important with your conversation. Suggestions as to how you can expand your customer base and get in the door. And then again, like I mentioned, who will be responsible for helping you once you're in the door, and suggestions as to how to maintain those relationships and earn referrals from them. But first, we're going to start by giving you a little bit of a um, snapshot of the industry as a whole. Of course, I can't get there we go. So the condition of the skilled nursing facility industry, regulatory skilled nursing facilities are one of the most regulated industries in the US, even more highly regulated than hospitals and nuclear power plants. They have a high level of scrutiny, a variety of surveys. So they have a annual Department of Health survey. They have a life safety survey annually. They have OSHA surveys, compliance, complaint surveys, all kinds of challenges, as well as sometimes civil monetary penalties are assigned for some of the citations they receive for those surveys. So reimbursement, the skilled nursing facilities are not reimbursed for the care they deliver in many cases. And we'll talk about that a little bit later to show you what that looks like. The reimbursement often doesn't keep up with the pace of inflation either, as we've just found out in recent years. They file annual cost reports, and their annual reimbursement rates are set on July 1 of the following year of that cost report for Medicaid, and then on October 1st of every year for Medicare. And so their costs associated with supplies are all captured on those cost reports. So that's another area that would be helpful for you to understand. And then from an economy perspective, obviously the cost of food and supplies has increased 10 to 12% on average. Um, it's starting to come down a little bit, but not very quickly. Um, Interest rates on variable loans increased from 8 to 9% in just a few months. Those rates also are finally starting to come down a little bit, but it's going to be a slow process. So those are all some of the additional financial challenges. And then environmentally, they face challenges such as staffing shortages, potentially negative press. Seems like anytime you hear anything about nursing homes, it's only negative. The media doesn't seem to focus on positive stories when it comes to nursing homes, and there are so many great things that are happening that they're not capturing. It's very sad. And then also increase in crime, theft, potentially medication theft by nurses, cybersecurity theft. There's been a lot of that happening. As you recall, there was a Change Healthcare cybersecurity threat hack that happened, and that held up, their ability to pay vendors. So there's a lot going on from an environmental perspective as well. So this is just a snapshot of the median operating margins for nursing homes over the last several years. So the golden bars represent the operating margin, which includes, beginning in 2020, any kind of stimulus money that was provided to the facilities to help them pay for personal protective equipment like gowns and gloves and sanitary wipes and things like that, and to help pay their staff. And then the blue bars represent what those margins would look like had they not received stimulus funds. So you can see there is a very large disparagement between the two operating margins. In reality, these were some of the recent news articles that came out, repositioning nursing homes for acuity, more closures, less deal making expected in 2024. Nursing home numbers reveal up to half could close in the next 10 years without major changes. And then another one, roll call analysis shows 188 US nursing homes closed in 2023. 40% of those had high star ratings. So nursing homes have a 5-star rating system established by CMS, and 40% of those closures had, high star ratings, 4 or 5 stars. So that's very concerning. I wanted to go over just in general to give you a quick overview. This is a very simplified example of how nursing homes are paid, so that you can kind of see how you fit into this picture, and you can kind of understand better the financial position of their reimbursement. So this particular example assumes they have a census of 75. Census means how many patients they have. So let's say they have a census of 75. It's a smaller nursing home. There are basically 4 buckets in general of payers that pay nursing homes. Private pay, which is becoming smaller and smaller because not a lot of people have cash to pay for nursing homes anymore. Medicaid only, or MyCare Medicaid, which is the most prevalent. Medicare A traditional, meaning they're just straight Medicare A, or managed Medicare, meaning they've been enrolled into a HMO plan like a Humana or an Aetna that covers them during their Part A stay. So the first row represents what the average daily reimbursement rates are for each of these payers. The second row is what that is on a monthly basis, because I want to look at this on a monthly basis, a net income perspective on a monthly basis for each of these payers. So that's what the revenue is. And then the monthly expenses. So basically medications that are that the patient receives while they're in the facility, labs, x-rays, transportation, therapies being part A, I mean, physical, occupational, or speech therapy. And then, of course, nursing costs and overhead is all lumped in that next row. So for private pay patients, they pay their own ancillary fees. So if they have medications or labs or transportation or therapy, and they only have private pay and no insurance, they pay for all of that separate. So that's not the nursing home's responsibility to pay for those things. They pass those expenses on to the patient. Nursing and overhead, $6,050. I estimated on a monthly basis for a center this size. We'll say that's what the monthly overhead would be. Then total per client per month. So this particular bucket, private pay, that nets out the $82.50 a month in reimbursement minus the $6,000 in overhead, comes out to about a net profit of $2,200. And we have seven folks, so census of seven. We have seven people who are private pay, which represents 10% of our total population. That's what the payer mix means. So if you take that $2,200 a month, multiply that by 12. I'm sorry, you take the $2,200 a month, multiply that by 7, because you have 7 people. You come up with a net income per payer per month of $15,400. So then let's take a look at the next row or column, Medicaid only. So that reimbursement rate's $250. The monthly reimbursement rate would be $7,500. So Medicaid folks, the nursing home does pay for everything associated with basically the care that they receive while they're in the facility. So if they receive medications and there's a copay that's not covered by their prescription insurance, the nursing home pays for that. They pay for x-rays and labs, transportation, and if they have no other insurance other than Medicaid and a doctor requires them to have therapy, the nursing home has to provide it and pay for that therapy. And then, of course, you have overhead again. So then the total net per client per month is a negative $100 for a Medicaid patient. So we lose money on Medicaid patients. So we have 53 people who are Medicaid only, which represents 71% of our total population. And so that comes out to a negative $5,300 a month if you have 53 patients and you're losing $100 each. Same goes for the Medicare A. Usually Medicare A, they've had some some kind of procedure or incident in the hospital, so their acuity is higher, and so their expenses are generally higher for things like labs, transportations, therapies, x-rays, those types of things. For a Medicare A patient, the nursing home receives a flat dollar amount, and that flat dollar amount needs to cover everything that patient needs while they're in our center until they go home. So let's say we receive about $525 a day, which comes out to $15,750 a month. The monthly expenses for a Medicare A patient are much higher because they're at a higher intensity of therapy, and sometimes they come in on high cost medications and may need labs and routine transportation. So we estimated $7,500 in expenses, minus, of course, the overhead again. So that leaves us a profit of $2,200 a month for this particular client. We're going to say we have 7 Medicare A patients, which is 9% of our population. And so that comes out to $15,400 a month in net income for that payer. And then the managed Medicare, that is like a Humana. So if somebody is automatically enrolled from a Medicare A into a Humana managed care program, Humana then becomes their primary insurance instead of Medicare A. And the reimbursement rate is a lot less for them because they negotiate the amount they'll pay the nursing home. So they collect $525 from Medicare but they only pay the nursing home 400. That's how they make their money. So we were reimbursed a lot less for a managed Medicare patient. And we have the same expenses because they're treated just the same as a Medicare A patient. But in this case, we're losing $1,550 a month on them because the reimbursement rate is so much lower. Let's say we have 8 patients in this payer, which is 10% of our total population. So we're losing $12,400 a month for those 8 patients a month. So if you consolidate all these payers and the net income per month, you come out to $13,100 a month in profit, which comes out to $157,000 a year. So what happens if that payer mix line towards the bottom there, right above where it says census, let's say that payer mix line changes and we have less people in our facility less patients who are on Medicare or private pay. Let's take a look at what that example would look like. So what we did is we dropped the payer mix, so there's less private pay, there's more Medicaid only, and then there's less Medicare A, and we're going to stick with the same managed Medicare. So now the payer mix changes quite a bit. So the net income per month comes to $750, and that's only $9,000 a year. So you can see how important it is for a nursing home to really try to manage their case mix, their payer mix. If they get in a situation where they are, are just keep accepting Medicaid patients into their empty beds, every Medicaid patient they're losing on. So they're never going to have an opportunity to recoup their expenses and turn a profit and be able to provide high quality of care and the extras that the nursing home clients would need. So they have to kind of keep some of their beds open so that they can bring in some of the skilled patients, which would be under Medicare or managed Medicare, to kind of make up for the losses that they incur for the Medicaid only patients. So I just wanted to give you a little idea. Hopefully that made sense. I'm happy to explain that further. If you ever have questions, please reach out to me. I'd love to go through this with you and give you some different scenarios. But that just gives you a good picture of how the revenue is generated. So who cares about what happens with vendor changes and who influences them? So this is just kind of a quick and dirty organizational chart showing you all of the departments within a nursing home. And the administrator is always at the top. Usually the second in command would be the director of nursing. And if the organization happens to be owned, it happens to be nonprofit, then there would be a board, and that board would be above the administrator. So out of all of these departments, generally speaking, the department leaders who would be interested in vendor changes because they're very conscious of their budget would be, of course, the administrator. The director of nursing could potentially, although not as much. The central supply person, if it comes down to equipment or supplies, generally the central supply person has a tight budget and is in control and understands, what's going on in all the clinical departments and probably is doing the purchasing as well in many of the respects. So the central supply probably would be the most influential person for supplies or equipment. If it is food, food vendors, dietary manager, of course, would be a high influencer in that area. And then therapy, they also sometimes come across some amazing equipment that could really benefit marketability of the center, quality of care for the clients, because they can advance some of the therapeutic options that they deliver to the patients. So they would be an influencer. The maintenance director is in charge of life safety. So a lot of times that the maintenance director has certain vendors they like to use, And, anything life safety related, the maintenance director would probably be the one making those selections and vetting those vendors. And then last but not least, business office generally doesn't influence vendor changes. The only reason I highlight it is if it's a smaller center and they don't have a corporate structure in place, then the business office manager could also be the CFO or finance director. So in that case, they definitely would have influence over vendor changes and vetting of those potential vendors. So once the influencers have expressed their interest in changing a vendor, the ultimate final decision maker is going to be either director of nursing and the administrator, or if it's a corporate structure, then those decisions most likely would be made by the corporate um, entity because they probably want to maintain consistency in vendors or they receive discounts for on a, for supplies and they utilize economies of scale. So absent a corporate structure, the administrator and director of nursing would be the two decision makers. So I wanted to give you a little background as to what some of the folks, some of the influencers that you're going to be talking to do, just so you have an understanding of how busy they are and what they have going on in their life, and help you understand maybe the best times to reach out to them and how you can kind of have valid conversations. So some of the things that administrators are responsible for, and if you happen to get my book, chapter 1 goes through administrator duties in detail, but they have department meetings every day, at least probably 3 meetings a day that are routine, in addition to monthly meetings and ongoing meetings with families and clients, patients. They're responsible for survey preparation because they like I mentioned, there is a Department of Health survey and a life safety survey every year. Plus, they have spur of the moment complaint surveys that may come in at any given moment that are all of these are unannounced surveys that just kind of pop up on them. And if it's a Department of Health survey, they're usually in the building for a week and it's a stressful time. So if you know there's a survey going on in a building, steer clear, do not go. That is not a good time to go. Um, investigations, they have to do investigations oftentimes in conjunction with the director of nursing. They do customer service and family satisfaction meetings. They're involved in customer service and employee satisfaction, plant operations, just a lot. There's a lot going on. The administrator is the head of the organization and is responsible for everything that goes on there. The buck stops with that person. So definitely very busy. And they also receive calls 24 hours a day, 7 days a week, depending on what the circumstances are. But very busy. The director of nursing, details are in chapters 5 and 6 of my book. They are regularly on call 24/7 unless there's an assistant director of nursing. Even if there is an ADON, they still receive calls when there are urgent matters that really she or he needs to be made aware of. They do daily review of nursing notes from the previous 24 hours. They follow up on physician visits. Sometimes are doing wound rounds, medication audits, nurse training and discipline, resident care, just a lot. It's a lot of times they don't get a lot of sleep at night because they are on call 24/7. And then they have to be at work 8 to 10 hours, a day in a fast-paced, stressful environment. So just keep that in mind when you want to approach them. And like I mentioned, the central supply purchaser, pages 9 and 84 of my book, they wear a lot of hats. They do facility-wide supply ordering, stocking, returns. They track medical equipment ordering and returns, and as well as loaned equipment, they track where that equipment is at, whether it's still being used, and they make sure that it gets returned. They do inventory control. Usually they're the safety director and conduct safety meetings. They are sometimes this also a staff scheduler backup. They're backup for housekeeping and laundry oftentimes, backup for dietary aid oftentimes. They're kind of like the go-to person whenever there's an extra person needed for something. I'm not quite sure why that is, but I've seen that in many, many facilities. They also assist wherever needed. So definitely they wear a lot of hats. So um, they're always trying to keep other the departments happy. Business office, they do billing and collections. They manage the aging, census maintenance, insurance verifications, care conferences, ancillary markups, ancillary tracking for billing, triple check meetings for before the billing goes out, Medicaid applications and follow up on those applications, and then of course Medicare and Medicaid rate change updates. If you ever have been into a nursing home and you walk past the business office, chances are if you look in, you're going to see something that looks like that. Um, they are they generally have the most paper of anybody in the facility, I feel. And a lot of times they don't have time to file. So their office often looks like that. So how do you get in? So I'm just going to walk you through kind of an example. Let's assume you're a Part B billing vendor. So ideas to help you earn trust of the central supply person and get your foot in the door. So if you can provide tools that make the central supply's job easier, you're going to be golden. There generally isn't a lot of training for a central supply person and not a lot of opportunity for education advancement or um, just efficiencies in general. So if you can provide tools such as how to track rental equipment and warranties on equipment that is purchased, that would be, definitely helpful. Maybe share special deals that other vendors have that might be of interest. Maybe obviously you're not going to share deals, that other vendors that are your competitors are offering, but maybe if you're an equipment rental vendor and you know of a dietary vendor that is having a huge deal, you might share that. Knowledge of a local facility that's willing to barter their excess supplies. So I've seen this work very well. Sometimes if the central supply person is very good at their job, they know exactly what they have overstock of that they are not able to use. And so if you're a savvy vendor and you have good communication with them, then you'll pick up on that and perhaps know of another vendor that you work with, facility that you work with that maybe could use those supplies. So I saw this happen with a nursing home that had a ventilator hall. They had folks on ventilator systems, vents. They decided to close down their vent hall and make that into a skilled rehab hall. And the vendor knew that another nursing home not far away that they work with was opening a ventilator hall and could use those supplies. So he coordinated uh, the two of them together and they were able to barter and trade some supplies. And then the one facility that had excess was able to also sell some of those supplies at a discounted rate to the other facility just to get them out of their stock. Inventory management tools or software, just ways to better manage inventory because as ancillary supplies are used, they can be, in some situations, they can be captured and billed to the client. So being able to manage that better is very a little bit challenging and would definitely be something that they'd be interested in seeing. And then anything else to make their jobs more, the easier, more efficient, cost effective. Make them realize you can help them by taking some of the ordering burden off of them. So Part B billing supply vendors usually set up auto shipping. And so they take care of all of the ordering and the billing. So that would be taken off of the central supply person, relieving them of responsibilities of keeping up with order changes. So every time there's order changes, the Part B biller, the Part B vendor is responsible for those. So the central supply person wouldn't have to worry about that. Helping minimize potential for missed orders or hard to read orders. Again, Part B biller is responsible for making sure the orders are legible and ordering everything and making sure they have the documentation. So that's one less thing the essential supply person would have to do. And then minimizing health safety citations for lack of supplies or wrong supplies due to supply chain issues. So like I said, they do auto shipping, so there's never going to be a lack of supplies because the client's always going to have what they need. So this is just one example. I'm happy to put together something specific to um, your clientele as far as vendor supply industry. If you'd like that, I'd be happy to do that. So strategic partnerships, some of the ways that, I mean, they say happy customers are your biggest advocates and can become one of your most successful sales teams. So how do you build those partnerships? So some of those ways you build partnerships with the organization in general could be through clinical education, offering free CEUs or happy hours. Nurses are always looking for happy hours and don't often get a chance to go and socialize and learn something. So definitely something to think about. If possible, provide a customized projected cost savings report as a result of implementation of your service or product. So if you have, and I've seen this used a few times and I thought it was golden. So the vendor put together a customized report with their logo, with the facility's logo on it and the administrator's properly spelled name. And they had some details about census and how much they can generally save per client. And they put together like a strategic report showing what a projected savings could be if they implemented their product or their service. So that was really very, very helpful. Anything that you have that you can hold in your hand and look at, some kind of a graph or color chart. People learn through their eyes, I think, a lot more than through email or over the phone. You can also share or like your customers' job postings or positive news to show your support. So that is always awesome. If you're on Facebook or LinkedIn, that you can go and you see that they're posting for an accounting position or a dietary manager, sharing that on your post on your LinkedIn site, that speaks volumes, and it's very, very helpful to getting the word out and helping them fill their openings. Support their mission. Find ways to do that. Attend or sponsor their events. Volunteer. I've seen vendors do spring cleanup. I've seen vendors come in and start a monthly book club with the residents who are, long-term care residents. I've seen them come in and conduct church services. So there's lots of volunteer opportunities to get your foot in the door and to build relationships. Join their board. If they have one, like I said, donate. Donate lunches to the staff. Keep in mind they have 3 shifts. Third shift oftentimes gets left out, so keep that in mind. Donate activity supplies for the residents. Talk to the activity director and find out what they need, because they usually have the smallest budget and they can definitely use donations. Don't be afraid to ask them for referrals and testimonials. Share the testimonials on your website and your social media. I would get a testimonial at the time they receive their first cost savings report from you. They're excited, and I guarantee they're forwarding that cost savings report to their boss to brag about the savings. So that's the time to capture the excitement in the form of a testimonial, because that's important. And then you have those for life. So to kind of wrap it up, how do you transform your business into a partnership? So the first thing is to understand the landscape, which we talked about, some of the financial and regulatory pressures. To build trust with the decision makers. knowing who those decision makers are, approaching them with empathy and service-oriented mindset, shifting from a vendor mindset to a partner perspective, and trying to meet their immediate and long-term needs while adding value. And then communicate your unique strengths and how your solution saves money, time, resources, or helps them even generate revenue. You're the experts with an easy solution. You have something they desperately need. You offer a stress reliever, and they need you. So just show them how much they need you and try to provide the answer to their prayers. I appreciate you investing your time with me. Um, so I am always open to collaboration. I like to co-present at conferences with other vendors. So if you're ever interested in partnering with me, with us to share insights and innovations in the nursing home industry, I'm happy to do that. Like I mentioned, my book, Profit Without Census, Nursing Home Administrator's Guide to Profitability by Department, that's available on my website. And then below is my phone number, my email address, my website, and then how to reach me on LinkedIn. I also have a group called Profit Without Census where we share cost savings ideas. So you're always welcome to join there. And if there's a group that you'd like to invite me to, I would love to join any group that you're involved in as well to kind of get the word out to other vendors. With that, thank you so much for your time. Again, thank you for investing your heart and your soul into nursing homes and our clients. What you offer is very important to how we manage our budget as well as our quality of care and how we take care of our employees. So thank you so much for wanting to learn more about us. And if I can ever be of assistance, please don't hesitate to reach out to me and have a wonderful afternoon.